Hey there, it's Dr. Lowenstein, and I just want to talk about some comments that I get periodically on Facebook. That's kind of what I wanted to talk about, but in fact, I've actually been trying to rearrange the camera this morning because the lighting is giving me bags under my eyes and showing my age. My grand age of 51. But I'm going to try not to think about that, and instead I'm going to think about this issue where people see posts about migraine surgery, and I've seen a lot of people post there is no cure for migraines, and that we are giving false promises and just treating migraine patients badly by discussing migraine surgery. And to be honest with you, I don't want to upset anybody, so I kind of just I accept that. And frankly, I'm not going around trying to tell everybody that there's a cure for migraines. Let's think about, a cure for polio vaccine, it's gone, okay? That's a cure. And migraine surgery is not a cure for migraines because it doesn't help everybody completely to eliminate migraines. What it does is it helps a lot of people, and it helps a lot of people by completely eliminating migraines, and it helps a lot of other people by vastly reducing their migraine load, shall we say. So, less than half the number of migraines and the severity of migraines following migraine surgery. Yeah, you can't call that a cure, but you can say it's a great thing. And as I've said so many other times, different medications work for different people. I suffer from occipital neuralgia and migraines. I haven't had surgery, and I haven't had surgery because I respond very well to Zomig. When my head hurts, I take some nasal Zomig, and I feel fine after that. Now, a lot of people have really bad side effects from Zomig. They feel really tired. There's various different things, and if that's the case for you, and you take Zomig, then you can't tolerate the side effects. Then migraine surgery it's a really potentially a really good option. But for me, when you're in general surgery training and you're operating for 5 days at a time, doing liver transplants and whatnot, you learn to get desensitized, I guess, to being tired. And so for me, I don't even notice being tired when I'm on Zomig, but it bothers a lot of people. The point of the story is, if acupuncture works for you, then great. Don't have surgery, have acupuncture. If medications work for you, then great. Don't have surgery. You've found an effective treatment. We are not trying to go around saying that we can cure migraines. But for people who cannot tolerate the other kinds of treatments or don't want other treatments, migraine surgery can reproducibly and reliably take your migraine pain down from what it is to at least 50% better. And again, in 40% of people, ballpark, you never have another migraine again. Now, again, you've got to be a good candidate. We screen you using nerve block mapping, which you can see on my website. Not everybody is a candidate for it, but for people who are candidates, it does work. The other thing to realize is that everybody, in all cases really of medicine, there are going to be some people that fail the treatment. So there's going to be a few people who their pain did not get better. And one of the risks is that the pain could get worse. Now, I've never seen that happen in my patients, but it can happen. And so those people often the most vocal because they're understandably upset. And again, while I haven't had this experience in any of my patients, it is a known risk, and a very, very, very small percentage of people have, it doesn't do anything, or even a smaller percentage of people, migraine surgery can make things worse. So, you may hear from those people a lot because they're vocal. Meanwhile, the people who have improved situations, 93% of people, are probably not online, complaining about the surgery because they feel better and they've moved on with their lives. So it's not to discount the few people that migraine surgery has not helped. We feel, when I say we, the plastic surgeons all around, we all feel very badly for that subset of people, just as when I did liver transplants, some patients rejected the liver. We feel horrible about that, and that didn't necessarily have anything to do with the care, but it happens. And so again, I just wanted to get on here and just kind of clarify that we are not snake oil salesmen. What we do works for the vast majority of people that are candidates. It doesn't work for everybody, and we're not, as a community of migraine surgeons, we're not trying to get everybody into our operating rooms. We're just trying to help the people that we can help, and spread the word to the people that we can help that there's hope and options. So I hope that is helpful, and at the same time doesn't get anybody too upset. For those who are interested in our candidates and are interested in finding out if they're candidates, please give us a call. For those who are not interested in surgery, that's absolutely fine and great. And everybody has to do what they're comfortable with, and that's our goals. Just to try and help people and let people know what's going on. All right, Dr. Lowenstein, again, take care.